Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera to all viewers. So I am Dr. Ashley Faiza Zulkifli. I'm a family medicine specialist and a clinical certificate at National Cancer Society Malaysia. And thank you for joining us in this debut episode of Prevention Matters, a panel discussion about dengue, dengue awareness and prevention of dengue. Bersempena dengan bulan kesetaraan dengue, which is June. Okay, and today we are joined by our panelists. The first one is Professor Dr. Rabsah binti Ahmad Saki. She is a public health specialist from University Malaya. And then we have Dr. Manika Kumaran. She is a health medical officer from Clark City Medical Center. And then we have our dengue survivor here, Miss Satya Bani Subramaniam. Dengue survivor, someone who had dengue and fortunately survived and well now. Thank you so much, everyone, for joining us today. Hopefully, we can talk about dengue in details and prevention of dengue.
So let us kick off by sharing this info. Malaysia has among the highest dengue infection rates per capita in Southeast Asia. So I'll ask my first question to Professor Dr. Rafsa. Could you share with us, from public health specialist point of view, the latest statistic on dengue in Malaysia? Are the cases getting higher and higher compared to before? And is it something worrying? Adakah ia membimbangkan?
Okay, thank you Dr. Ashley for the introduction and also inviting me to this session. So, dengue, I think everyone know that in Malaysia, dengue is endemic, means that we have dengue cases all the time. And in terms of dengue cases also, for this year, for example, up to April this year, we have more than 95,000 cases, which if we compare for the same period last year, it's increased dramatically, because the same period in 2024 we have about 44,000 plus cases. So I mean, you can see there's how much different between previous year and this year. And if we compare the trend from the end of the COVID pandemic, I would say that the trend is actually increasing. And yes, we do have a drop during the COVID-19 period due to the movement control order. But once we end the restriction, the cases start to shoot up back again. And as we all know that dengue is closely related to the mobility, because you know, like we know that the mosquito carry the virus, and also human, once they're infected, they become the carrier as well. So when there's a movement around, the spread is much faster. So with the higher number of cases, we see more people with severe dengue and more people with deaths. So last year, in 2024, we have about 117 deaths because of dengue. So this is what we want to prevent, because the aim that we know that our MOH is targeting of zero dengue deaths, and also it's actually a global target that we want zero dengue deaths to be achieved, because dengue is something that you can, one is preventable. Second, if you have the disease, it can be detected early, and if you detect early, you'll be able to manage them, and definitely death is preventable.
Okay. Okay, thank you, Prof. So, you know, Malaysia, we have been doing, you know, in terms of public health measures, the foggings, you know, the stagnant water elimination programs, campaigns and everything. So we've done all these things, but why are the cases still high? You know, what are the main challenges that we're facing now?
Okay, as I mentioned, dengue is endemic. Endemic means that the virus is in our community. So we know that we've seen that people doing fogging regularly every week, but you know, we do still see cases. Yeah, but we have to understand, fogging is actually to kill adult mosquito only. So when we talk about dengue management, it needs to be integrated. You cannot just based on one way of preventive measure. So fogging is actually targeting adult mosquitoes. So actually, if you look at the Ministry of Health how they manage dengue outbreak. So when we have a dengue outbreak, cases, then we do fogging, because the target is actually to kill the adult mosquito who carry the virus. So that's the fogging. Then of course, apart from fogging, we still have to continue doing the environment control. So we want to remove the stagnant water to prevent the breeding of mosquito. And again, this is go back to the mosquito cycle itself. You know that mosquito cycle is very short. So within 1 week, it can reproduce. So that's why what the KKM been telling us, please do the cleaning every week, because some people say, I already did that last week, so I don't need to do it again this weekend. I want to take a break from that. No, because mosquito cycle is within 1 week it will reproduce. So you have to do all the checking, cleaning every week, so that we can clear the stagnant water. Yeah, and another thing is interesting about mosquito is the mosquito egg. It can survive in a dry condition for a long period. Study have shown that it can survive up to 3 to 6 months. So when in the dry season, you don't see water, let's say in the flower pot, you think it's okay, but once you have water introduced to the egg, it can reactivate. So if you remember, one of the advice that we give to public is when you clean the flower pot, not just throw and wash, you have to brush the flower pot. The purpose is to remove the mosquito egg, because it can survive. So once it survives, you have the cycle back, and then you still have the mosquito lah. So that's why everybody need to take their part in preventing dengue.
Okay, I learned something new today.
Yeah, exactly.
Yeah, so you have to keep cleaning every week.
And you have to brush it off.
That's right. Yes. Okay. Yeah, and the fact that it can thrive after being inactivated for like 2 or 3 months, dia boleh hidup balik lah
That's why
katakan.
you see sometimes after like hujan kan, after hujan tiba-tiba nampak increase number of dengue cases. Yes, yeah.
Thank you, Prof. Thank you. Okay, I want to move on to sign and symptoms of dengue. So demam dengue versus demam biasa. At what point? I'm going to ask to Miss Sakia lah. Okay, what was your experience when you had dengue infection, and how did you know that? Oh my God, it is dengue.
Alright, so I had it like few years ago when I was doing my uni days. So first of all, like when I had a fever, it was started with a fatigue fever. So I thought it's just like a normal fever. It's just a fever because I went to a KK and then just take a paracetamol. That's how we treat it. Then the next 3 days it continues. There is no any changes. So and it gets severe. Like I think it's called as a breakbone disease for a reason. Since I had a joint pain and back of your eyes is still pain. When I stand up, I feel dizzy, no appetite, and all the symptoms. So when we did a blood test in KK, so that's where they get to know, okay, I'm suspected for dengue. So I terus masuk ambulance and then went to
Masuk
HKL.
ambulance?
Yes, from KK to HKL, they brought me to ambulance. Because I couldn't even stand. Yeah, no movement at all. So they masuk ward at HKL. So I was admitted for about like 1 week, and then I get my treatment. So that's how I get to know it's not like a normal fever. Normal fever, I think after you take your medications to reduce and everything.
Yeah.
But for dengue, you have to treat it differently.
So you were admitted in HKL for 1 week.
Correct.
1 whole week.
Correct.
Okay. Thankfully you recovered. Okay, I'm gonna ask Dr. Manika. As someone who has experience working in the emergency department before, what was your experience looking at dengue patient in emergency setting, and how do you recognize whether this patient needs to be admitted, that patient don't need to be admitted?
Yeah, so basically we all know that everyone who has fever right now, you have access to emergency department lah, okay? They go to the green zone kan. So in an emergency setting, patient can present themselves with the spectrum of symptoms. But the usual one, like how she said, the retroorbital pain, the fever, you're feeling the tiredness, and then you have your body aches, right? This is very common. But as it is mild, presenting as a mild disease, it's also very deceptive because it mimics other viral fever. So I understand why KK just gave her paracetamol at the time being, because it's just, we wouldn't think of it. But we also know that dengue is very time sensitive, right? So you need to detect dengue early, right? And dengue has 3 phases, right? The febrile phase, the critical phase, and then your recovery phase. So if we don't catch dengue at the critical phase, where they present themselves with all these warning signs. Dengue is very important for you to know about their warning signs, right? So warning signs basically is patients who come in with that complex of symptoms that I mentioned. On top of that, they have vomiting, they have bleeding disorders, or they have tendencies of bleeding. What I mean to say, they have a drop in blood pressure. When they come in with these kind of symptoms and with severe abdominal pain, they are very severely lethargic, right? This triggers us to sort of, hey, maybe this patient sebenarnya ada dengue, you better go and investigate, right? So at that point of time, this is already at the critical phase. Any patient who comes in, from my experience, in an emergency setting, who comes in a critical phase, definitely warrants to get an admission, because that's when you can't foresee how the complication can become severe or not. And we also know that dengue can become severe. It can become into dengue hemorrhagic fever, and it can go into dengue shock syndrome, right? So you have to be very careful with that. But also, that being said, when patients come with mild symptoms without presenting with warning signs, I think the best thing we can do, instead of making a conclusion that it's just a viral fever, maybe run an FBC. Because an FBC tells you a lot of things, right? It tells you about drop in your platelet. It tells you about your increase in your hematocrit. When you see something like this in the FBC, it triggers us for us to do our dengue diagnostic test lah, your NS1 kit and stuff like that, right? And this sort of helps us to early diagnose dengue in an emergency setting. So then again, it's very patient dependent, and it's also based on their clinical symptoms and their severity of their blood tests. This is how we determine whether this patient is warranted for admission or dia boleh balik but with close monitoring still lah. I think most dengue patients, they have this card. We send them back home with FBC daily, to do this trend and all that. But of course, patient yang kita rasa symptoms dia mild enough, we send them back lah. Those we think this is going into critical phase, usually we don't take the risk, we get them into admission.
And this is to show that it's important to detect dengue infection early.
Yes.
Okay.
Yes.
To avoid, to sort of
prevent
prevent.
missing out the critical phase, especially because they can, in this critical phase, the 3 to 7 days of dengue fever, they can actually go into very severe dengue, which is dengue hemorrhagic fever, or dengue shock syndrome, especially when you have BP loss, you have bleeding tendencies. I think even as simple as a gum bleed, you need to admit the patient already. Yes. And also another thing, I think for primary medicine, or your KKs and your clinics and stuff, you have to be very careful in managing fever. Patient can present with like sakit, kan? You come in with headache, you come in with abdominal pain, right? I think it warrants a test before you treat the patient, because if you give medications like NSAID, which has bleeding tendencies, you actually push the patient into a more critical state if the patient sebenarnya ada dengue fever lah, right? So I think all this, being in the emergency setting, this taught me a lot lah about how to sort of criterize or sort of compartmentalize patients who actually have dengue or severe dengue.
Yes. Okay. Thank you, Dr. Malika. That's really a good answer. Okay, Prof, I nak tanya lah then, who are the vulnerable group of people lah? Macam ni kita, siapa high risk, A dengan B, dua-dua ada demam biasa, belum masuk critical lagi, tapi mungkin dia akan masuk critical lah. So what are the risk factors we look at in patients?
So in the general, in any disease or infection, those yang vulnerable group are the younger group, the younger children, also the very elderly group. But another group that we have to be cautious is actually those who with diabetes, and also who are those with obesity. So these are another 2 group that we have to be extra careful. So even though they do not show the severe symptom or at the early stage, in some setting we still need to admit them to monitor their progress, because they can progress to the severe state very
Fast,
sudden, very
yeah.
fast. Difficult to predict them. So these
Yang
are very
obese,
vulnerable group.
yang obese tu, 1 in 2 of us is obese, doctor. Prof, 1 in 2 of Malaysians are obese.
Yes,
So all kira macam 50% of us high risk lah.
and diabetes also quite high prevalence of it. So these two group we really need to be careful. And then a recent study shows that those like children with malnutrition, especially those who are anemic, they might have a tendency to develop severe dengue. So that's why we have to take care of our health in general also, to make sure that our body have that enough immunity to fight this virus when they come to infect us.
Okay, yeah. So the high risk group is the younger, the older, the ones with diabetes, obese, and kids. Maybe if they have anemia, malnutrition, then they are at high risk also lah. Okay, Miss Satya, what was your experience again in while admitted? What was done to you? What sort of investigation that they do to
So
you?
I think it's really quite painful because almost every day, especially in the morning itself, the doctors will poke you and take blood tests. Yeah, and it's like time to time you will be monitored, and then medications, and it's actually good in a way that you have been monitored by them on daily basis. But as a patient, I think I went through lots of pain. Yes, that's why I say it's not easy as you see. It's
So
not.
sakit symptoms lagi, and then sakit being monitored.
Almost every day they make sure your platelets and everything is in right order and everything. So that's how
And what are the doctors looking at, Dr. Manika, with this investigation and monitoring?
Yeah, usually it's the daily FBC lah. Kita nak tengok whether the hematocrit is increasing and the platelet is dropping below 0. So that gives us a picture. Basically, we have a baseline.
Platelet dropping below 0.
Below 100. Yes, below 100. So it's dropping below 100. It means patient is going into a very critical phase, and we need to be more careful. And another thing, I think they also take your BP monitoring because they want to make sure that your vital signs are stable. Once it starts dropping, it indicative that you're going into some sort of shock, and and that's more complex. Another thing is when you experience more symptoms like your shortness of breath. It tells us that you maybe have plasma leakage, which is another sort of side effect of getting dengue lah. So we have to, I think they monitor a patient in a whole, but blood test by itself tells us about this. We monitor usually the hematocrit, whether you have leukopenia and your thrombocytopenia, these three things. When it drops into a certain level or the hematocrit increases more than 20% of your baseline, so men and women have their own baselines, then we know that the patient is probably going into another stage. Yeah.
And dengue infection, there is no specific treatment for it. It's just a supportive management, right?
Yes, correct. So it's basically just IV fluids, symptomatic reliefs, your nasal prong, your oxygen, whatever if patient needs and stuff like that, your paracetamols, regular PCMs. Unfortunately, we don't have antibiotic you makan you terus zap. Yeah, that's why I think you had to stay for a week. Oh yes.
So that's when dengue infection ni it's a prevention punya we need to prevent it because there's no specific treatment for it. So I think now we can spend some time to talk about prevention. We mentioned stagnant water care and also fogging, right? Now we've heard about this dengue vaccine. Okay, and I would like to talk more on this lah. So we want to spread awareness to the public that hey, you know what, we have dengue vaccine now. So I'll ask this question to Dr. Manika. Tell us a bit about dengue. How does it work? Who's eligible to get dengue vaccine and so on?
So dengue vaccine is fairly new here in Malaysia. It's called Dengue. Okay, I think it just was allowed for us to use it in 2024. So that being said, of course, I think the awareness of people about the vaccine is still quite critically low lah. People tak tahu benda tu dah keluar. Okay, so dengue vaccine, as we know, it prevents against 4 serotypes of dengue. So dengue actually have 4 serotypes. I mean, correct me if I'm wrong, Prof, but it has Den B1 to Den B4, kan?
Yes.
And this dengue vaccine is preventative for all 4. Okay, so it's a live attenuated vaccine, which means it's the virus is weakened, okay, and then it's put it into your body lah. And it helps to prevent from dengue. Who is allowed to take the vaccine? I think children from the age of 4. This is from the recommendation guidelines, from the age of 4 up to 60. And as Prof said, those who are obese, those who have diabetes, I think they also need to get, or they are actually advocated to get this vaccine. The vaccine is pretty simple. It's a subcutaneous shot, and it's taken as 2 doses. So the first dose, and after 3 months will be your second dose. But there is a group of population who are not allowed to take. So that's pregnant women and breastfeeding women, because we don't have enough researchers on that, and also people who are immunocompromised, those who are going immunocompromised, meaning yang ada HIV and stuff like that, and of course people who are undergoing chemotherapy. There's also a group of people who is allergic towards this vaccine. So bila you dah dapat first dose tu, you may be allergic to the vaccine because there's some components, some proteins in there that doesn't tolerate with your body. Then you're also not allowed to take the vaccine anymore lah. Okay, but the research done by this company Takeda, especially in a group of children, it states that it reduces hospitalization risk in children by 90%, and also prevents them from getting severe dengue by almost 65 or 70%. So the vaccine works lah, basically. It's just that I think kesedaran belum lagi. Yes, it's because it's new. It's new, and we didn't have like that implementation like we had for COVID vaccine kan. Masa tu you kena ambil, kalau tak you tak boleh travel. You know, so
So it will take some time.
it will take some time. I think, you know, people like Prof, like ourselves in health screening and all, we have to really like tell people, look, there's vaccine here, go get yourself protected. We also know this thing that sekali you dah dapat infection for dengue, the second time bila you dapat dengue, it can be more severe than your first infection. So these are people who are more prone. We try to push them, go and take your vaccine, because you know, if you get it the second time, you're probably going to be in trouble lah. Yeah.
And I've heard about this dengue vaccine, Qdenga. Is this the only dengue vaccine that we have? You know, Prof, macam pneumococcal, kita ada few types, you know. Is this the only one that we have now?
Okay, when we talk about at the global level, actually there are 2 vaccines available, dengue vaxia and Qdenga. And Qdenga is very new. But in Malaysia, only Qdenga is actually has been approved to be used in Malaysia. Because there are various reasons lah. I think when we talk about vaccine, you know that public always worried or concerned about vaccine. And especially with dengue vaccine, I think if you remember long time ago lah, when they introduced dengue vaccine, there was issue with the vaccine. Even though it was approved, but that vaccine was approved to those who are with, say, who never had a dengue before. So the problem is, if you had a history of dengue, and then if you receive the vaccine, then the tendency that you will have severe reaction with that. So that was the problem with dengue vaccine. I think that's why at that time the Ministry of Health did not approve that vaccine to be implemented in our country. I think it was good steps to take, because one thing, to exclude those who without dengue, I think is difficult as well. You really need to have a very reliable test to exclude them, and then means that in terms of implementation, before you give vaccine, you have to do another test to confirm that they are free of dengue hassle. So that's why that time we did not approve that vaccine to be applied in our country. But like we mentioned earlier on, recently we have another candidate for dengue vaccine, which is Qdenga, which is based on the data. We know that the effectiveness is fairly good in terms of like preventing the symptoms up to 80%, preventing hospitalization up to 90%,
Yep.
and this because of how the vaccine developed is different from dengue vaccine, so makes that this is more suitable to the area who are endemic with dengue. So it means that if you had dengue before, it's okay to have the vaccine. In fact, you are encouraged to have the
Encouraged,
vaccine
yeah.
to prevent severe dengue.
Yep.
So it was introduced last year,
Yep.
and of course the knowledge about the dengue vaccine itself is not there. And then like you mentioned, some people don't even know that there's dengue
The
vaccine
vaccine.
exists. And then some people who are aware about the vaccine, they really associate the vaccine, the current vaccine, with the previous dengue vaccine.
Yes.
So they are worried to take the dengue vaccine, which is I would say is totally different way of their producing and the mechanism of working with Qdenga compared to
So
dengue
there's
vaccine.
that misconception.
Yes,
Padahal this Qdenga, you can actually take it even if you had dengue
Yes,
before.
yes.
Okay, yes. So let me ask Miss Satya, have you had the vaccine before?
Yes,
Okay.
actually yes. I took
Good
it
on
in
you.
Feb,
Ah.
and then my second shot was in May.
Okay.
So I take it as like Dr. Menaka quoted. So it's better to take for the people who already got it.
Okay.
So that this, because the second time it's gonna be severe. So first time itself I couldn't take it. It was very painful. So I don't want to go through what I went through earlier.
Yes.
So to prevent it, I think it's better for prevention rather than the cure. So I took the vaccines already.
Okay. Prof, just quickly, is this a lifetime injection? You get 2 doses 3 months apart. Does it cover you lifetime?
Currently, we don't have enough data to
Data.
say that. But with any vaccine, surely at one time the immunity will be waned. So, but I cannot comment on that because we don't have enough data to say that once you have these 2 jabs, you are protected for life.
Yeah,
In fact,
yeah.
most of vaccine, you don't have that fully 100% protection.
Yeah.
Okay. I think from what I heard, I think it's so far it's good for 4.5 years. So nanti after that, more data will come and then they will tell us whether we need a booster or not. Okay. So I think I want to go around the table. Actually, no, I want to ask Prof first. Prof, then how, as a public health specialist, how do we increase acceptance of these vaccines and how do we raise awareness about dengue vaccine?
I think the first thing is we as a healthcare provider need to equip ourselves. I mean, we
With the
have to show the
knowledge,
example to others that we need to, if we want to educate them, we need to have the knowledge. Yeah? And then I think we have to utilize what is we have now, things like social media, because that's where the we say
Awareness,
the group who are, I would say the anti-vaccine group is much more active. And then the problem is with this social media and internet is they have this algorithm. When the more people feed the negative or the wrong information to the system, when we search the information, it will automatically give the negative feedback to your question. Yes, so I think we need to put in more information about the correct information about the vaccination, about dengue prevention, to the media, to the internet, so that when we search vaccine, all what will come to you is actually positive information. So like I mentioned, we have to start equip our knowledge and give education, and then try to promote that to the media that most people use for now lah. Like we are doing, we hope that this will be uploaded in the internet and people will see this.
Yeah, I think there's still a lot of HCP, healthcare professional, that still don't know about the presence of
Correct.
dengue
Qdenga,
vaccine. Yeah. So we're trying to get that awareness across HCPs and then also to the public.
Correct.
So I think we're towards the end. So I just want to go around the table and maybe just ask one key message that you would like to share with the Malaysian about dengue or prevention of dengue. Kata-kata akhir lah, Prof.
Okay, from me, I think the prevention is every individual need to take their own action. Even though we say that there's a vaccine exists, yeah, but you still need to continue with other way of prevention. Things like take care of your environment, make sure there's no stagnant water, make sure there's no potential breeding site to be exist. So once we do that, then hopefully we'll be able to control the dengue cases, and then please keep increase our awareness, especially to detect the early symptoms, because our aim is towards zero dengue death with early detection.
Yep. Okay. Zero dengue death. Okay. How about you, Dr. Monica?
Pretty much along the same lines. Okay, for me, I think knowledge is power. The more you educate yourself about how bad dengue can be, what are the preventive measures, the availability of preventative medicines or vaccines and stuff like that. I think to all people out there, when you see your doctors, yes, it's good for you to do your health screening, but at the same time, I think ask more questions about things that can be more relevant towards your health, such as vaccines, what you can do to prevent from getting dengue and stuff like that lah. Because as you know, the death rate is still very tolling. I think it's very sad to hear that people die because of dengue. It's a preventable disease. So just educate yourself more and be more open to sort of preventative medicine lah, I would say. Yeah.
How about you, Miss Satya?
So I would say something similar. As a survivor of dengue, I would say that don't take it easy on the early signs.
Okay.
Yes, look it better into it, and I prefer that prevention is better than the cure. So go for the preventions, not only taking the vaccine, but also as quoted by Prof. Rabza, the stagnant water and awareness, and what are things you can do. Just go for it. Don't take the dengue as a simple illness.
Don't take it for granted.
Correct.
Okay. Yeah. Okay. All right. Thank you so much, everyone, for joining us in this debut episode under Prevention Matters from NCSM. Very valuable facts that we got from each one of you. Thank you so much. Okay. Thank you.
Thank you.